Okay, we're going live. Get ready to go live. Okay. Hi, everybody. It says on the screen, it says you are alive. So I'm so glad that the screen knows that I'm alive. So I know I'm alive. You're alive. Everybody's alive. We're starting up. I just want to take a few minutes and introduce you guys to somebody that I've met recently. I'm really excited about what they do because it's different than what anybody else does. You know, if you're in the medical field, whether you're a MD or you're in the senior healthcare field, anybody that deals with having to have Medicaid to pay for it or insurance to pay for it, if your job depends on Medicare or Medicaid paying for it so that you get paid, this is good information, whether it involves you or whether it involves anybody in your company, because most of the people that I know and that I work with, and like on a lot of the things that we do are in the senior healthcare industry, and they're more concerned about the sales end or the referral end of it. This is on the other end of it for the facility and for the doctors and stuff. But this was really exciting. I liked it because everybody has heard of the side of the business that deals with billing and stuff like that. This is part of the billing, but it's even more important than that because there's some scary things that are coming down the pike. And when I met this gentleman named Scott Crabtree from Med Mandate, I just had to get him on the phone and do it real quick and ask some real quick questions. So let me put this up. This is his stuff, and let me bring him on. I don't want to remove you. I want to. There's Scott. Hey, Scott.
Hi, how are you?
Can you hear me? Oh, good.
Hi.
Well, we're on live right now, and I just want to ask you a couple questions. When you told me about this, I got real excited about it because having at one time really depended on money coming in from Medicare and insurance and stuff like that. When you go into a doctor or you're talking to a doctor, how do you introduce yourself? What do you tell them that you do?
Well, I introduce themselves, of course, my name,
Scott,
and Scott Crabtree, and with Med Mandate, and that I'm contracted with Precision VBM. Precision VBM owns the platform that grades and ranks physicians and facilities from payers, hospitals, and ACOs. So this platform is what grades and ranks them for reimbursement. So what they don't realize is that, and they completely are unaware that they're being penalized for leaving revenue on the table. There are a lot of population health assessments and mandated metrics that they're not doing, they're unaware of. So I've been very fortunate to get to work with this new platform. It's only been out a couple of years. In 2018, they won a big global award for medical technology. And the gentleman I work directly with is 2019, he was inducted into the top 100 leaders worldwide in technology. So we're at the cutting edge. This is at the very cutting edge.
Okay, so a facility or a doctor's office or a home health care center or any business that they have an medical records, EHR and stuff like that, this stuff is not even in their EHR. Is that correct?
Correct. They're unaware of this. And what we can do with our technology, we can go into their EMR, their electronic medical records, health records. We can tell them and show them to the penny. I mean, to the penny. And we have examples of this on the website. Go to the website. That to the penny, we can show them exactly what revenue they're missing, what they're getting penalized on, what they need to be doing. And so again, they are unaware of this, and this is new. And by the end of 2022, 2023, things are going to get really rough, and that will affect their patients. That's the big thing right there. It's going to affect their patients.
Well, so, here, the thing that excited me about it when you explained it to me, I was excited because, as a lot of people know, I've had some particular health issues, and I've been going to the doctors and stuff of that nature. The interesting thing, even though there's part this is medical mandates, and a lot of the doctors and the people that take care of the healthcare people that take care of us don't know all the things that need to be done. What this actually does is once you get in there and show them what they need to do, then I, as a patient, get a lot better care. Is that correct?
Correct. Absolutely. There are a lot of assessments that you need and that you're not getting. And the doctor would love to do that if they just knew, but they don't know. So what we do is get with the physician and their administrator, and we'll upload this information from their EMR, and we'll show them exactly what they're missing.
Okay, so it actually helps the doctor, help the patient, getting all this up, and you guys your team over at the Med Mandate and the VBS people, you guys actually help get people like me to do the things that need to be done, that complies and gets all the tests that I need. Is that correct?
Correct. With the correct information. Again, this is cutting edge technology. So with this information that we get from their EMR, from their practice, we can engage their entire patient population with text, email, one click. Within that, the patients have a very interactive, friendly, easy to use portal. They'll have their own website. Each individual patient will have their own website login, and they can go in and do these assessments. Currently, this past year, we've been tracking 21 million patients on the institutional side, and we have 6,000 PAs on the telemedicine side, pardon me. So they can we can assist them in any which way. So going into that patient portal is very fun and interactive, and it also it greatly assists the doctors, and this is where the missed revenue part comes in. It will greatly assist the doctors in getting their patients to say, hey, I need you to come on in here and do these. So, and not to overload their office staff or to overload their office, they can do it simply online. They can do it on their phone, tablet, or a computer, or they can come into the office, either way.
And so it helps the doctor to do a better job with me as a patient. It takes care of me as a patient by making sure I do all the things I need to do. And the doctor doesn't necessarily have to see me. He could have one of his PAs or somebody like that see me and give me the results. Is that correct?
Correct. They can use, the doctor can use his staff, or you can use our staff, either way.
And so the doctor makes money that he should already have been making, but didn't know was there for him to make.
Correct.
Because
absolutely.
Number one, the billing people don't know this, and his medical records don't know this. I think the way somebody explained it, I was talking to somebody else. He says there's 100 different things that I, as a patient, need to know and be checked on. Okay, but the doctor doesn't know all those 100 things. He only knows maybe 8 to 10 of those things, and so I'm missing all that other checkup and help for my health, and he's missing all that money on that. And because he's not doing those things, he's getting penalized because he's not doing those things that he doesn't know he needs to be doing. Does that make sense? I mean, is that correct?
Yes, that's absolutely correct. So they're getting penalized for, simple, the bottom line, they're getting penalized for leaving money on the table. And in turn, the patient isn't getting what they need. So, this will greatly help the physician, the patients. And we've made it with this technology, it makes it seamless, makes it very easy for both the patient and the physician.
So let me ask this. why doesn't the medical billing people, why aren't they able to do what you guys can do with this? Why are you able, I mean, what makes you able to do this and other people didn't know about it? Why?
Because we own the platform that
You got me,
payers.
Scott?
Yes? Can you hear me?
Go ahead, say it again.
Can you hear me?
I can hear you.
Okay, great. No.
Yes, sir. Keep going.
We own the platform that payers, Medicare, private payers, hospitals, and ACOs use to grade rank these physicians. So they're unaware of this. Data, policy and data at a very high level is being transferred all the time. However, this part of the platform that I represent is for the physicians and facilities. Again, they're unaware of this. This is new. And so they need to get on board now, because the time is coming that they're going to be, the penalties are going to get huge. They're already getting penalized. You know, they have, kickbacks. The terms are kickbacks and dings, partial pays, no pays, slow pays. So this is why. And we can eliminate all that for them.
You called it like clawback?
Yes,
Clawback?
clawbacks, which would indicate that they are basically, they're CMS, Medicare, let's call it, is going back through their books and going, wait a minute, you didn't do this and this and this, and so we're going to take this money from you. That's to the physician. And so the physician is
so it's
frustrated.
So money that they've been paid. I mean, like one part of the, I got even more excited about this when I went to talk to my doctor about something he required me to get, but the insurance people told him he couldn't do that test. And he needs that test because the test that the insurance company said he could do wasn't precise enough. So, and he said that they're getting really, really rough with the doctors now. I said, Doc, you need to talk to Scott because they've got something that will help you with that. And I mean, like the way I explained it to him, I did that thing of if there's 100 things and you're only doing 8, Scott can make sure you get all of that and get paid for all of that. Is that true?
Correct. Absolutely correct. That's correct. Yes.
Okay. So I just wanted everybody to know about this. I'm putting this out, and I will be sending as many people as I can to this and get as many people to see this little video. Your email is scott@medmandate.com. Your phone number is 720-357-4941. And your website is medmandate.com. And so it's good for both the physicians and the patients. That's the beauty of this. It helps put money back in the doctor's pocket. Now, let me ask this. I know you were telling me that it normally costs $400 or $500 to run one of these practice evaluations, but y'all are taking care of that. You're not charging for that right now. Is that correct?
That's very correct. Yes, that's a value to that. Where we decided to waive that and to basically eat that cost because we know the doctors need this help. The docs need it, and in turn, their patients need it. So yes, we're very happy and excited to do that for them, to be a great service to them. And what that will require is getting with the doctor, their administrator, office manager. We would get a file, an Excel file or a CSV file. We can upload that within about 48 hours, a little less than that, but we just say 48 hours. We'll present them to the penny with a nice laid out report, exactly what they're missing, what they're getting penalized on, and to the penny, the revenue that they're missing out on this.
And yeah, I was so excited. I told my doc, I said, Doc, so you get with these guys, you work with them, they'll start making you money in 15 minutes. So good. That's why I said. So Scott, I appreciate your time, and I'm going to go ahead and end this here and end the broadcast now and get it back up on all the different platforms on Facebook, YouTube, LinkedIn, get as many places as we can on websites and stuff, and get people sharing this with their doctors to help them and the patients as well. So, Scott, I appreciate everybody. Thank you for joining us. If you're watching this on the replay, we appreciate you being here and finding out about this information. I'm excited because not only does it help the doctors get money that they already deserve that they're not getting paid for, but it also helps me and our patients get all the things that they need, according to, quote, the government, to make sure that they're getting and staying as healthy as possible. So thank you, everyone. Thanks for coming and joining us today. Dr. Vetter, I will talk to you later. Scott, thank you for coming on. Everyone, glad you're here. Please let's get the word out and help both doctors and patients. Okay. Thanks. Bye, everybody. I'm going to end the broadcast. Bye. Thank you for joining us.